Hi, my viewers. Welcome to c-meditech Online Academy. So, I'm here to discuss some of the most important questions of our Gulf Pharmacist exam, DHA, haad, emerge, prometric, SPLE. Shall we start? Yes. First question. What is the mechanism of ranitidine? The options are H1 blocker, H2 blocker, beta blocker, alpha agonist. The answer is H2 blocker. H indicates histamine. It is actually autocoid which has been derived from amino acid histidine. Okay, it is an H indicates histamine. It is an autocoid or biological factor which has been derived from amino acid histidine. There are two types of H receptors, H1, H2 receptor. H1 I will discuss it later. Now I am focusing on H2 receptors. H2 receptors are nothing but receptors which are located in GIT. It helps in increase in production or secretion of gastric acid. Okay, H2 receptors are positioned or located in GIT and it increases the gastric acid secretion. H2 blockers is otherwise known as H2 antihistamines. So these blockers or these types of drugs acts on the H2 receptors which is present on the GIT position or location, and it decreases the gastric acid secretion. Okay, H2 blockers, it acts by decreasing the gastric acid secretion by binding on H2 receptors which is present in the GIT. And these types of drugs are mainly used to treat peptic ulcer diseases. And this includes H2 blockers or H2 antihistamine includes drugs like ranitidine, famotidine, nizatidine, roxetidine, cimetidine. Okay, I will say once more: ranitidine, famotidine, nizatidine, roxetidine, and cimetidine. Okay, moving to next question. Second question, test for respiratory infection. The options are patch test, Wilson test, auscultation, percussion. The answer is auscultation. Actually, it is a procedure where we listen the internal sounds of the body by using a stethoscope, and we place the stethoscope directly on our chest, back, and abdomen, and it is performed for the purpose of examining the circulatory system, respiratory system, as well as the alimentary canal. Okay, so it is a procedure where we focus or listen the internal sounds and its variation of the body by using a stethoscope, and it is placed directly on chest, back, and abdomen, and it is purposefully used for examining the respiratory system, circulatory system, and alimentary canal. Okay, moving to next question. Which of the following is the precursor for 5-hydroxytryptamine? The options are tryptophan, valine, leucine, arginine. The answer is tryptophan. Actually, 5-HTT is produced by hydroxylation followed by decarboxylation of tryptophan. 5-HTT is produced by hydroxylation followed by the decarboxylation of the amino acid tryptophan. Question: which of the following is a term used to describe the pharmaceutical technique of grinding an insoluble substance to fine powder while wet? The options are titration, levication, attrition, milling. The answer is levication. So levication is a procedure or pharmaceutical technique which is used for or indicates grinding an insoluble substance to fine powder when it is in wet form or wet state. Okay, levication is a technique of grinding an insoluble substance to fine powder when it is in wet form. Okay. Next question. Which ethical principle explains prevention of harm and removal of harmful conditions? The options are autonomy, beneficence, non-maleficence, justice. The answer is non-maleficence. So, non-maleficence is ethical principle which explains prevention of harm and removal of harmful condition. Actually, there are 4 ethical principles: autonomy, non-maleficence, beneficence, and justice. Autonomy is a right of an individual to make a self-decision regarding the choices among the healthcare providers, and to take decision regarding what to take or what not to take regarding the medication, or choices of refusing the treatment. So it is actually a right of individual to self-rule or self-govern and to make decisions among the choices. Okay, choices like what to take, not to take, and the choices among the healthcare providers, and choices among the refusing of healthcare treatments. So non-maleficence deals with prevention of harm or removing the harmful conditions. It is duty to avoid causing harm to minimize harm to the patients, where beneficence focuses on benefiting the patient or to do benefit to the patient, duty to maximize benefits and to enhance patient's well-being. Okay, beneficence focuses on mainly the benefiting the patient, to do benefit the patient, duty to maximize the benefits and to enhance patient's well-being. And justice means deals with treating every patient equally, fairly. For example, asking the patients to stand in queue, So it mainly focuses on treating the patient, every patient equity and fairly. Okay, so there are 4 ethical principles mainly. One is autonomy, non-maleficence, beneficence, and justice. Sixth one, antidote for warfarin. The options are vitamin K, BAL, BAL, EDTA, deferriprone. The answer is vitamin K. Vitamin K is used as an antidote for warfarin. BAL or British anti-leukocyte or dimercaprol is used for heavy metal poisoning or mercury poisoning. EDTA is used as an antidote for treatment of lead poisoning and mercury poisoning. Deferriprone is used as an antidote for iron poisoning. And warfarin is actually a blood thinner or oral anticoagulant which makes the blood to flow more easily. It makes the blood to flow more easily. It acts by inhibiting various factors, clotting factors like 2, 7, 9, 10. Okay, this warfarin acts by inhibiting various clotting factors like 2, 7, 9, 10, and it is not generally given as OTC drug due to increased risk of bleeding. And it is antidote used for warfarin is vitamin K and is normally monitored by using INR, International Normalized Ratio. I will discuss more about it on later classes. So warfarin is an oral anticoagulant or blood thinner. It acts by inhibiting various clotting factors like 2, 7, 9, 10, and it is not given as OTC drug due to the increased risk of bleeding. So here the answer is vitamin K. Vitamin K is used as an antidote for warfarin. Seventh one, which of the following is an inhibitory neurotransmitter? The options are aspartate, serotonin, glutamate, GABA. The answer is GABA. Actually, this neurotransmitters is classified into 3, like biogenic amines, amino acid, neuropeptides. Okay, neurotransmitters is classified into 3: biogenic, amino acid, neuropeptides, and it is again classified depending upon its action or mechanism, like excitatory or inhibitory. Here, biogenic amines, excitatory neurotransmitters are acetylcholine, adrenaline, noradrenaline, dopamine. And serotonin can act as both excitatory or inhibitory neurotransmitter. Amino acid, here excitatory neurotransmitter is glutamate. GABA glycine acts as inhibitory neurotransmitters. Neuropeptides, excitatory substance P, and inhibitory is metenkephalin. Okay, so neurotransmitters is generally classified into 3: biogenic, amino acid, and neuropeptides. Depending upon its mechanism, it is classified into excitatory and inhibitory. So serotonin can be act as both inhibitory as well as excitatory neurotransmitter. Here the answer is GABA, which is act as an inhibitory neurotransmitter. Question: a 20-year-old woman, pregnant woman, presents to the emergency department with severe vomiting. What is the most likely safe drug? The options are pyridoxine, ondansetron, domperidone, promethazine. The answer is pyridoxine. The pyridoxine doxylamine combination shows no increased risk of birth defects. So, and it is only the FDA approved drug for nausea, vomiting in pregnancy. So here the answer is pyridoxine. Pyridoxine combination with doxylamine shows no increased risk of birth defects, and it is the only FDA approved drug for treating nausea and vomiting in case of pregnancy. Next question, which medication is added to levodopa to reduce the required dose of levodopa? It can be asked directly or like case study. For example, a 67-year-old woman old man presents with complaints of tremors, trouble walking, and masked face. Parkinson's disease is suspected. Levodopa is prescribed along with a compound to lower the required dose of levodopa and to achieve an effective brain dopamine concentration. Which of the following is the most likely compound? Examples: percolate, selegiline, carbidopa, and decapone. The answer is carbidopa. L-DOPA or levodopa is a prodrug. It is lipophilic in nature. It can cross blood-brain barrier, BBB, so that this carbidopa helps in preventing levodopa from being broken down before it reaching the brain. This levodopa, which can cross blood-brain barrier, undergoes metabolism in the periphery of the brain, and so that sufficient amount of levodopa will not be available. So that we are introducing or incorporating carbidopa or benzerazide drug, which belongs to class of medication like D-carboxylase inhibitors, so that it prevents metabolism of levodopa, or it works by preventing levodopa from being broken down before it reaches the brain. Okay, levodopa is a lipophilic drug. It is a prodrug. It crosses the blood-brain barrier, but it undergoes metabolism in the periphery by decarboxylase enzymes. But when we are incorporating or we are introducing carbidopa like a drug, which is a decarboxylase inhibitors, it prevents metabolism of levodopa. It prevents levodopa from being broken down before it reaching the brain. Okay, so that we are introducing levodopa along with carbidopa, and it allows for a lower dose of levodopa and which causes less vomiting and nausea. Last question. A 70-year-old woman presented with complaints of severe dry cough for a week. She has been recently prescribed hydrochlorothiazide and captopril for hypertension, salbutamol and fexofenadine for allergic asthma. Which drug is the most likely reason of patient's complaint? Options: captopril, salbutamol, fexofenadine, hydrochlorothiazide. Answer us captopril. It is a ACE inhibitor. It is a drug that acts on RAS system, and it is used actually ACE angiotensin converting enzyme helps in conversion of angiotensin 1 to angiotensin 2. So ACE inhibitors usually works by inhibiting this conversion of angiotensin 1 to angiotensin 2. So that here the answer is captopril. It is coming under the classification of ACE inhibitors, that it is a drug that acts on RAS system and decreases the BP. So ACE inhibitors, the most common side effect associated with ACE inhibitors is dry cough, angioedema. So here the answer is captopril. Okay, this captopril is coming under classification of ACE inhibitors. It inhibits the conversion of angiotensin 1 to angiotensin 2, but the main side effect associated with this type of drug is dry cough and angioedema. So here the answer is captopril. And other drugs which is coming under this ACE inhibitors are enalapril, ramipril, lisinopril, captopril, quinapril, and trandolapril. So this is all about today's session. We'll be back soon with another. See you soon. Bye.